My name is Dana Costescu. I'm a breast cancer nurse specialist and I work in Royal Berkshire Hospital. I've been working there for 15 years almost, but my background is theater, operating theaters. I worked there for 15 years and I moved to oncology side about 6 years ago. Do I enjoy being a breast cancer nurse specialist? I do enjoy. I do enjoy being there for my patients, absolutely. It's difficult for them, first of all. It's difficult for us. But with so many trainings that we had, we managed to be there for them, not to cry too much. So tonight we're going to talk about breast cancer in general. I'm not going to go into details unless you have certain questions, of course. But we're going to focus on prevention, detection, diagnosis, and all this. While I'm talking, if you have any questions, you all have a phone, just go on your notes and write some questions, not to forget to ask me later on. So let's start. Breast cancer, so we're going to talk about early detection and diagnosis, causes and risk factors, myths and misconceptions, NHS breast screening program, probably many of you know about that, and also prevention. What is breast cancer? Breast cancer is a disease in which abnormal breast cells grow out of control and form tumors. Breast cancer cells begin inside the milk ducts or in the milk production lobules of the breast. If left unchecked, the tumors can spread throughout the body and become fatal. Just for you to have an idea how the breast looks like, so here is the nipple, so it's from the side. Here are the milk ducts. That's when the cancer starts. And we're going to talk in the next slide how it's called that non-invasive cancer that is within the milk ducts but doesn't have an ability to spread yet. And then there are the lobules. Lobules or the milk ducts are surrounded by fatty tissue. We have the chest muscle. It's very important because sometimes cancer goes in the chest muscle and also the ribs. So common type of breast cancers is ductal carcinoma in situ, commonly is called DCIS. It's a non-invasive cancer. It didn't spread beyond the milk ducts. Every cell, and we're going to talk about in the next slides, every cell has a DNA. Every cell in our body, we were created with cells that they have a DNA, or better say, every cell has their own brain, and we're going to talk about how actually develops from there. So it's the non-invasive cancer in the milk ducts. Invasive ductal carcinoma is the most common type of breast cancer. And cancer starts in the milk ducts and then spreads into the breast. And then invasive lobular carcinoma, this is the second most common breast cancer. And it starts in the milk-producing glands in the lobules in the breast and often spreads into the breast tissue. This is a very hard type of breast cancer to be detected because in the microscope doesn't look like cancerous cells, doesn't look like a formed lump. It looks like normal cells. So you might not, somebody that might do self-examination, they might not notice the breast cancer, this type of breast cancer. So MRI has to be made for this type of cancer and ultrasound. We have less common breast cancer types is triple-negative breast cancer, as this invasive cancer is aggressive and spreads more quickly than other breast cancers. Is the inflammatory breast cancer is a very rare cancer, but still fast-growing cells looks like a rash on the breast. And Paget's disease of the breast, this rare cancer, less than 4% of all the diagnosed patients, affects the skin of the nipple and may look like a rash. Just be aware of all these changes. We're going to talk about changes a little bit more later. It's very important for the doctors and for us to know the breast cancer staging and also the grades. So breast cancer staging is determined by the type of the cancer, the size, and the location of the tumor. And if the disease has spread to the other parts of the body. A doctor will determine the grade, better say pathologists will determine the grade after it will look under the microscope. Grade is 1, 2, and 3. And based on how the cancer cells appear under the microscope, this gives a sense of how quickly the cancer could grow and spread. And knowing the stage and the grade allows doctors to determine the most effective treatment. So we'll go to the breast cancer stages. Stage 1, the disease is non-invasive. Remember, I said the DCIS, which means has not spread from the breast duct to the rest of the breast. Stage 1, cancerous cells are present in the breast tissue and formed already a mass, a lump. Stage 2, the tumor cells have produced one or more than one lump, or is less than 2 centimeters, and after the surgery found out that the cancerous cells are present in the lymph nodes. Or the tumor is larger than 5 centimeters, but the lymph nodes are not involved. That's stage 2. Stage 3 is a local advanced breast cancer, which at the diagnosis time, patients come with a lump. It's very easy to detect that, and the lymph nodes are involved. The lymph nodes are abnormal at the diagnosis time. And stage 4 is the metastatic disease, when cancer spread from the breast to the bones, liver, lungs, or brain. The receptors are very important because we don't know, but on the surface of our cells, breast cells, we have some receptors. It's estrogen receptor and progesterone receptor. If they are both positive, we know that we have to give an extra treatment for who has estrogen or progesterone positive. HER2 is called human epidermal growth factor receptor 2. And it's like a protein that sits on the surface of the breast cells. And that's, again, is very important because if that's positive, we have to give an extra treatment. It's a biological treatment, and it's very important. And also we have estrogen receptor negative, progesterone negative, HER2 negative. That means triple negative breast cancer, which I said to you is the most aggressive type of breast cancer. The primary breast cancer treatment, as the most important treatment, better say, is surgery. Cancer is treated 80% with surgery. The tumor is out, and then we give extra treatment, depends on the type of cancer. So surgeries are mastectomies, lumpectomies, breast reconstruction, surgeries for lump nodes, can be sentinel lymph node biopsy or axillary node clearance if the lymph nodes all are involved. I can give you details at the end if anybody has questions about the surgery. Oncological treatment, medical team may combine surgery with one or more of the following treatments. Chemotherapy, and that can be neoadjuvant chemotherapy is given before surgery, or adjuvant chemotherapy after the surgery. Radiotherapy, immunotherapy, endocrine treatment, and targeted therapy, as I said, biological treatment for HER2 positive. I know it's a lot of information. They're like, what is she saying? But just want you to have an idea. If you ever hear anybody that has breast cancer, just for you to say, well, I heard about this. Special treatments. Some women have an increased risk of breast cancer because family members have it, or they inherited the genetic mutation. And they might want to consider the following: genetic screening for breast cancer genes, medication that might lower breast cancer risk, prophylactic, preventative, which is mastectomy. Some women even remove their ovaries if they have BRCA1 or BRCA2, and frequent breast cancer screening and physical examination. If you have an increased risk for breast cancer, ask your doctor if you should have additional tests to detect breast cancer, particularly if you're under 40 and have a family history with cancer. It's very, very important to know that. Causes in developing breast cancer. Breast cancer cancer's causes are unknown, but a complex genetic environmental interaction is possible. Why some people without risk factors get breast cancer, while others don't have the risk factors and still get the cancer, is a mystery. Nobody knows. But the risk factors that everybody talks about can include hormones, lifestyle, and environmental influences. And we'll talk into details about this. I'll tell you briefly about the DNA mutation. So you can see here, the cell starts beautiful, And then suddenly it starts a mutation. Milk gland cells mutation lead to breast cancer, affecting ducts or lobules, as we said. Some other breast cancer cells become malignant but rare. We talked about we talked about it at the beginning. The Paget's disease and the, will come to me. So how it starts, the breast tissue cells, the breast tissue cells alter the DNA. The cells follow the DNA instruction. As I said, we all have our, and they are controlled by the DNA. The DNA controls how the cells grow, how they reproduce, the timing of the cell's death. But when the DNA changes, they receive a different instruction from that brain. And the cells, good cells grow, the cancer cell grows, and the other ones die. And they divide rapidly, the bad ones. Healthy cell can die while cancer cells survive. In other terms, in that cell is a different brain that starts developing. And the only way to kill that brain is with chemotherapy, with poison. That's the only way we can destroy the bad behavior of that cell. And that's the reason in some cancers we have to involve as a treatment chemotherapy. Risk factors in developing breast cancer. Being 55 or older, women are more likely to develop breast cancer than men, even though 10 years ago it was 2% men, but these days it's 3-4%. So more men, they develop breast cancer, unfortunately. Family history, if your parents, siblings, or other close relatives had or have breast cancer, you are at risk. That doesn't mean necessarily you will get the cancer. You are at risk of developing the disease. Up to 50% of people with breast cancer have inherited genetic mutations. The most common genetic mutation are BRCA1 and BRCA2 genes. We said that earlier. Smoking has been linked to many different types of cancer, including breast cancer, and is one of the highest risks for infection after surgeries. Drinking alcohol, research shows that drinking alcohol may increase breast cancer risk, obesity, and radiation exposure. If you had prior radiotherapy, especially to your head, neck, or chest, you are more likely to develop breast cancer. There are other risk factors with no research foundation, but you heard this in the news or people talking about. Hormone replacement therapy, HRT, have a higher risk of being diagnosed with breast cancer. We don't recommend for someone that had breast cancer and had estrogen receptor positive, we don't recommend them to have HRT, but that doesn't mean patients that they've been on HRT necessarily will develop breast cancer. It's just a discussion. Beginning your period at young age. There are many women that start the period at young age, yet they didn't develop any breast cancer. So we don't have any data about, but there are discussions about this. Beginning your menopause at older age, having first child at an older age, having never been pregnant, menopausal hormone therapy, dense breast tissue, or personal history of breast conditions. Some patients develop, when they breastfeeding, they develop lots of cysts, and many people say, well, I'm going to get cancer because of that. That's not a risk factor. There are just discussions all over the place, but there's no foundation for that. Breast cancer symptoms, and I'm going to focus on this because you'll be able to actually see what is here. Thick area, which partial swelling, and you can see a swelling on the side of this lemon. Dimple, nipple crust, red or warm, fluid, blood stain, clear. Growing vein, sunk nipple or inverted nipple, different shape, suddenly your breast starts developing or it becomes in a different shape, man or woman, orange peel skin, and a lump that you feel when you touch. Many of these changes can also result from other non-cancerous health issues. So all of this You can go to the doctor and they say, it's no breast cancer. But yet, however, if a person notices any changes in their breast tissue, they should see a doctor as soon as possible. It is important to rule out cancer as a possible cause. How is breast cancer diagnosed? Healthcare providers may do physical examination, which is very important, or order mammograms to check for sign of cancer. But they do some other tests to diagnose the disease if they have any questions. Ultrasound, breast ultrasound, MRI, breast biopsy, immunohistochemistry. As I said, they have to check the hormones level, the hormone receptors, estrogen, progesterone, and HER2, and genetic tests to identify mutations that cause breast cancer if family history of cancer. NHS screening program is very, very important, and the most important line of this slide is you need to be registered with GP surgery to be invited for screening. So if anybody is not registered, this is the most important thing. Be registered with your GP. If you are born as a female, you should be and you register the GP, you should receive a letter when you're going to be 50. And that letter you should, and you should receive that letter in between 50 and 53. But from 50 and 51, every 3 years, you will have a breast screening. Most people, what question should I ask my healthcare provider? If you hear anybody that has breast cancer, or if you heard anybody shocked, or if you have to experience with some of your family member, have this in mind. They are very important questions because this way you can make up your own strength how you're going to go through this journey, if I can say that. What type of breast cancer do I have? What's the tumor stage, size, and grade? They are very important. What's the estrogen and progesterone receptor status? What's my HER2 status? What type of surgery? What other treatment options? Is there any clinical trials available for me? These days, we have so many clinical trials. They are so beneficial for different, certain categories of patients. So these questions are very important because that way you're going to understand and you can ask questions the nurses, the doctors, and everybody that takes care of you at that time. Can breast cancer be prevented? You may not be able to prevent breast cancer, but you can reduce your risk of developing it. Regular self-examination and mammogram can help detect breast cancer early on when it's easier to treat. Breast self-examination, so I'm gonna try to be graphic a little bit. We all have breasts in this hole here, so we all know. You have the skin here, so put your arm on your shoulders, and with the other hand, just go around your breast, up and down your breast, around your nipple, and go under your axilla, and check every single month. And you can do this in the shower is the best way because you have soap on your hand and going around your breast, on your breast, under your axilla, you'll be able, your palm will get the information, how it feels, how it is. And if you ever develop anything in the future, your palm, because you got the information, will tell you something is not right there. And also this examination is, you can do it after your shower, lie on your bed, and with lots of lotion or cream on your hand, do the same thing on your breast, on your nipple, and under your axilla, both sides, just to know your body. It's very important. Teach your children, boys and girls, especially girls, young girls, teach them to do self-examination once a month, once every 3 months, no matter. But it's very important to do this self-examination. Some people have thicker breasts than others. If you have thicker breasts, you may notice lumpiness. A benign tumor or cyst can also cause lumpiness. So if you have a breast that is heavy and full of lumps, that doesn't mean you have breast cancers. Even though it might not be cause for alarm, talk with your doctor promptly about anything you notice that seems unusual. That's the most important thing you have to remember from here. Talk to your doctor about anything you notice that seems unusual, and as I said, your palm will tell you because you got used to that. How can I lower risk of developing breast cancer? There's no sure ways to reduce breast cancer risk, but they are the following advice. Keep healthy weight. Ask a healthcare provider for information on setting up healthy weight management. Have a healthy diet. Some studies show a diet that includes vegetable, fruits, calcium-rich dairy foods, and lean protein may reduce your risk of breast cancer. Avoid red meat and processed meat, palm oil, and reduce sugar intake. New discovery is palm oil, that we find that in so many things, but it's the most damaging thing that we can get in our body and helps that DNA to change its face. Regular exercises. Studies show that regular physical activity, 30 minutes a day, lowers breast cancer risks, reduce breast cancer risk for coming back or to develop new one. The data says if somebody walks 30 minutes a day, reduces the chances for the cancer to develop up to 40%. But that walk has to be fast walk. Somebody that goes to gym regular and use the muscles and use the weight, it can reduce the chances of the cancer to develop with up to 60%. So this is you can be your own doctor and prescribe as much exercise as you would like, because that can reduce the breast cancer risks. Avoid alcohol. Research shows a link between breast cancer and alcohol. The American Medical Association recommends limit alcohol to drink a day. If you can do that, that will be great. Get screened. Mammogram often detects tumors when they are too small to be felt. Do regular self-exams. Examining your breast regularly helps to maintain breast health and may allow you to find breast cancer tumors at the first stage. This may save your life. Lots of misconceptions about breast cancer. I'm just going to go through them and see if you ever heard about any of this. Finding a lump in your breast means you have breast cancer. That's not true. Men do not get breast cancer. It affects women only. We said that's not true. A mammogram can cause breast cancer or spread it. Not at all. If you have family history of breast cancer, you are likely to develop breast cancer too. Again, it's not true. Breast cancer is not contagious. And I put from myself there, doesn't go from one breast to the other. Many patients come and say, oh, next year I'm going to have in the other one just because I have on this one. It doesn't work like that. Antiperspirants and deodorants can cause breast cancer, and that's not true. A breast injury can cause breast cancer. Breast cancer is more common in women with bigger breasts. Breast cancer only affects middle-aged or older women. Unfortunately, lately we have many young patients, more than we ever had before. Breast pain is a definite sign of breast cancer. It's just the opposite. Breast pain is most commonly to be a benign tumor, a benign cyst, something, but it's not cancerous, saying that we still have patients that develop cancer with the pain in their breast. Consuming sugar causes breast cancer. Not that you consume sugar, that's the reason. It can help the cancer to grow. Carrying on a phone in your bra can cause breast cancer. All breast cancers are the same. Never compare someone's cancer with the other one. We have patients and they say, oh, I spoke to my neighbor and she said she has the same breast cancer like me, and I know what she's been through, and I'm going to be exactly the same like her, and I'm going to be fine. Never compare the same exactly twin of a breast cancer with someone else, because the development of that cancer depends a lot of individuals. And brass with underwire can cause breast cancer. That's not true. These are the notes that you've seen in slides before, but I just wanted to put them there one more time just to enhance that for us. If a person notices any changes in their breast tissue, they should see a doctor as soon as possible. Even though it might not be a cause for alarm, talk with your doctor promptly about anything you notice in your breast that seems unusual. Get screened. Mammogram often detects tumors when they are too small to be felt, but on time to be cured. Do regular self-exams. Examining your breast regularly helps to maintain breast health and may allow you to find breast cancer tumors at the first age. This may save your life. Regular self-examination and mammogram can help detect breast cancer early on when it's easier to treat. So everything, all this, they say the same thing. They just wanted to repeat. At least you're gonna go home with this. If you have an increased risk of breast cancer, ask your doctor if you should have additional tests to detect breast cancer, particularly if you're under 40 and have a family history with cancer. And this is my last slide. Life is beautiful, precious, and frail. Live it to the fullness every day with peace and joy. Spend time with family and friends. Be kind to yourself and others. No one knows what tomorrow will bring. And because I'm a Christian, I will say if anything will come towards us, if we have to go through thick and thin, God will always be there with us through fire and water. Thank you very much. Yes.
Thank you. Yeah, thank you, Sister Dana. I'm just checking on YouTube if we've had any questions, but this is now the moment for any questions that you may have. I have one.
Yes.
So you said that there was, if you have changes to your skin and you had a rash.
Yeah.
If that, even without a lump?
Even without the lump.
Okay.
There are types of breast cancer. They don't start in the duct milks or in lobules. I'll go for the first slide because that's the one I forgot. The next one. Less common breast cancer, Paget's disease of the breast. This cancer affects the skin on the nipple and may look like a rash. So it's no lump, just a rash. And it's only on the skin. And inflammatory breast cancer, that's the word I was looking for and it didn't come to me. This rare, fast-growing cancer looks like a rash on the breast. So no lump. They don't grow inside, they grow from outside. Yeah.
All right. Does anybody have any questions? Okay, 1 second, I'm bringing it to you.
This probably is not related to breast cancer, but as you mentioned that if you breastfeed a child, and let's say that a lump appeared or a couple of lumps, and then the mother is not sure what is going on, so it left to the level where the breast swollen, red, etc. So it's quite a heavy, where the doctors have to go with a surgery way. You said it doesn't link to the cancer, so...
In general, it doesn't.
Right.
But you have to have that examination, and if they feel a lump that is not mobile, they have to do a mammogram or at least an ultrasound to see if there's anything abnormal there.
Mm-hmm. Got it.
Unfortunately, because you mentioned that, we had a patient that she was breastfeeding for a year or so, and since she started breastfeeding, she had like a rash, like a heavy breast, few lumps, and she went to the doctor from the beginning for a year. And they said, it's nothing, it's normal, it's just like that. And she didn't insist, but it's not moving, but it's there, but it's growing, she didn't do that. And when she came, she already had a cancer developed in the lymph nodes. So she went to a different stage. Unfortunately, she even became metastatic. So the cancer was there for a long time, and it wasn't aggressive because she was very young. So yeah, doctors can make mistakes. But if you go there, you insist and say, well, it's been there for a long time, it's growing. I would like to have an ultrasound. I would like to have a mammogram. I'm not breastfeeding now anymore, but it's there and it bothers me. They should be specialists, of course, and we should trust whoever examines, and we should know whatever they have experienced, they know how it seems like, how it feels like, and all this. They should, put you on peace and say it's nothing wrong. But unfortunately, we had cases when it was too late, or it happened that it wasn't just a cyst. Yeah.
Thank you.
Yeah, you're welcome. Any other questions?
Does breast cancer come with the other red flags like weight loss?
Definitely, but when somebody loses weight, that type of cancer, whatever that type of cancer it is, it went into the organs. So it's very late to cure it. When somebody starts losing weight, just up out of nowhere, has to have an MRI, CT scan to look to see what it is. Because you might not feel anything here, but actually it might be. Or have something somewhere, and even, let's say, it is in the liver. They have to do a biopsy, they have to do a CT scan, they have to know where that liver lesion came from. In many cases, it came from the breast, but they never had a type of lump that will bother them to go. Or many people, many patients, they say, I'm fine. And they don't come because of lack of education, lack of confidence. They are scared, they don't have anybody, the children with to go to the doctor, or they go to the doctor and they go so many times and they are, they just give up to do that. COVID times gave us really good lessons because patients didn't go to the hospital, and when they came to us, back to us, many of them, they came too late. So, yeah. Loss is very important. If somebody had breast cancer before, or any type of cancer before, that can be recurrence, and lost weight is one of the important thing that we look into it. Yeah.
Okay, just a quick one. You mentioned some statistics about exercising and cancer. Was it specific to breast cancer you're referring to? I didn't hear
Any type of cancer. The data was done for the breast cancer, but for any type of cancer, exercises. I don't know if you heard the expression, sitting is the new smoking. So the more somebody sit, the more they smoke themselves into their body, because the blood doesn't circulate, the blood doesn't pump, the heart doesn't pump. So sitting is the new smoking. The more you're active, the less the cancer cell has the ability to develop, because it doesn't have time.
Yeah, that's quite interesting to hear, because I would have thought so around just cancers in general. But when you exercise, your breast is probably one part of the body that is the latest one to kind of have any effect of the exercising on your breast.
Yes.
So that's why I was just wondering if it was breast specific as well as the rest of the body.
Is for any type of cancer. With the breast, as we know, after a certain age, 50, 60, women have more chances to develop breast cancer because of the hormonal changes. That doesn't mean I will get the breast cancer just because I got into menopausal. So the reasons are very tricky. When somebody will find out how a cancer cell learns how to develop and to multiply and to grow and to divide, then we'll eradicate cancer. But until then, we just know how to treat it, how to give treatments, how to apply surgery and all this. But we don't know why, for some people, they have such high risk smoking and drinking, and yet doesn't have any type of cancer. And me on the other side, lifestyle, brilliant lifestyle, and we had patients, and they were absolutely knackered and upset. Why do I have breast cancer? When I'm doing this, and she was right. We don't know that answer yet, unfortunately.
I came late with the presentation, so I don't know if it has been mentioned.
I can do it for you again.
Thank you. I don't know which Hollywood celebrity had double mastectomies.
Angelina Jolie.
For prevention, because of the family history.
Her mom had ovarian cancer. So if somebody has relatives, mom, aunt, grandma, with ovarian cancer and breast cancer, it's a lot of relation in the genes. So somebody has to be detected. They have to send a form to Oxford together with the blood to see if there are any genes present. And if the result comes with a BRCA1 or BRCA2, this is what Angelina Jolie has, BRCA1. She had to remove the breast. She had to remove her ovaries to make sure that the chances for the cancer to come back is not gonna, or to come to her is not going to happen. That doesn't mean that's not going to happen. That doesn't mean for sure she's going to get it. That doesn't mean for sure she's not going to get it. It's just reducing that risk of removing the breast tissue, everything what is in the breast. That's where the breast cells starts in the milk ducts. You weren't there at the beginning. Starts in the milk ducts. So we don't have the milk ducts anymore. We remove them. And also the ovaries, because her mom had ovaries. So that's when they produce the hormones changes and all this. So she removed everything that can develop, or it's a chance for developing the cancer. Yeah.
She's a lucky one because she can provide for all this treatment, but NHS doesn't provide that, do they?
But yes, it does.
Oh, okay,
yes.
for prevention.
If somebody, yes.
And,
If somebody comes, so if the test result comes with a BRCA1 or BRCA2, and now it's another one another type of genetic mutation that came is a new one. If all these genetic mutations, they come as a result from Oxford, patients are offered double mastectomy and also to remove their ovaries. They are offered that.
Right.
It's up to them to say, yes, I want it, because it's not 100% that they will have that gene to develop the cancer. It's a risk, even taking everything out, because taking everything out, it messes up with your body.
Yes.
So you have to make that decision. The decision that somebody makes about their body is the best decision, because it's yours. So they have to make that decision, but it's an option for them, definitely. It is in NHS an option to remove, to have double mastectomy with implants or not, or the other type of reconstructions, or they can have the ovaries removed, they can have the uterus removed, they can have everything if they want to.
Thank you.
But if they are young, they have to have another extra treatment, because their hormones are still producing. We still produce our hormones because we have in the fatty tissue, even though our ovaries will not produce. So it's a whole history about that. It's not easy to make that decision. Yeah.
Okay.
Yeah.
Thank you. I just want to say, in terms of NHS, I had an unusual lump, and they even sent me to a mammogram on a Saturday. So I think, I don't know if it's to do with areas, but if you have a concern, no matter what age you are, they will send you if you press.
Yeah.
I just want to ask, can you go to your doctor and insist on having a scan? Or can you just go randomly and be like, I just want to have this scan done?
Without having a lump or any symptoms?
No, I wouldn't. Okay, yeah.
No. And the answer no is no, because many people believe if they'll have an MRI or a CT scan or an ultrasound, they will see something. And definitely they will see if it's a lump there, if it's a tumor, if it's a mass. But if it's no mass, we don't see the microscopic cancer cells. And we all have bad cancer cells. And we all have bad cells, and we have cancer cells. That doesn't mean that they will develop. They will learn to develop at a point if we don't have a good DNA in them. But for somebody just to go and say, I want to have this and this and this, they're not going to do it in NHS. You can go privately, and they will show you, here is the MRI, CT scan, ultrasound, mammogram shows nothing. And in a year, you develop breast cancer. And you say, I've done all this last year. It didn't show anything. Why it shows now? Because it didn't show microscopic cancer cells that learn to develop in that year. Yeah, make sense?
Hi, Sister Dana.
Hi.
I just have a question. So yearly, the NHS will send a letter for us to have females to have a pap smear done.
Every 3 years after 50 years.
Yeah, probably 3 years.
Yes,
Probably,
every
because
3
it
years.
seems so close.
Every 3 years. Only for
Yeah.
breast cancer patients, they receive every year for 5 years
All
after they
right.
finish their treatment, but not for regular patients.
Okay.
For us, it's every 3 years after 50, not the young ones.
Well, my question is, if we can have a pap smear, an invite for pap smear, and breast cancer is so common, so dangerous, why can't there be a letter to invite us for a checkup for breast cancer as well? Is it something
If
that
you're
they
not
do
50.
if you're over 50, do they do that? Or?
If you're not 50, because most common breast cancer starts after menopause.
Yeah.
So to have breast
45 to
cancer
50, yeah.
earlier, unless you have medical history in your family with cancer,
Yeah.
or you find a lump, you're not going to be invited.
Okay. So after 50, we can expect that
After
letter coming
50, yes, you will be
yearly or
invited.
every 3 years?
Every 3 years.
Every 3 years.
So
Thank
let's
you.
say I turned 50, and until I was 53, I didn't receive any letter. So I called and I said I didn't
you
receive
check
any
your
letter.
GP?
But they say, well, you don't have to receive it on your 50s.
Oh, great.
Can be in between
Thank
50 and
you.
53. Yeah.
An online question is, does oral contraception increase the risk of cancer?
It was there, a slide with HRT. Yes and no. As we said, there are risk factors. It is a risk factor. That doesn't mean somebody will develop breast cancer because of that, because there are so many women that they were on baby pills, but they never developed breast cancer so far, and they are elderlies. So there are risks there. So somebody has to make up their minds. I'm taking this risk. I might get breast cancer, or I might not get breast cancer. Yeah. Yeah, done?
No, I just wanted to add, I remember this in my university lecture about oral contraception and breast cancer risk. I think it's like the risk only comes if you use it for over 10 years. So it's like a prolonged period of time of consistent use that it increases your risk,
Yes.
rather than just taking it like a year or two and doesn't really do anything. So yeah, just like everything else, it's a risk factor.
Yeah. Yeah, absolutely, you're absolutely right. But that doesn't mean necessarily somebody that is taken for 10 years for sure will get breast cancer.
Yeah.
So they're all risks up there. Yeah.
I have another question. It said if you haven't had children, there's a higher risk. Do we know whether, like, what's the protective measure, or if there is any?
Yeah, that slide, there are discussions here and there. Is no data, is no research proof that somebody that didn't have babies will get breast cancer necessarily. No, it's no data for that. Protecting yourself not to get pregnant, that's a different story, that's a different slide. There are different slides and different discussions. Yeah. Well, thank you very much, everyone. Yes?
Okay.
The leaflets are here. We have some leaflets. I'm just going to present them to you. Thank you very much. Know your breasts. So take one, and you will know how to do the self-examination, reducing your risk of breast cancer. Treating primary breast cancer, if you know someone or anybody is going through that, just to have an idea. Family history of breast cancer, if anybody is at that risk. Understanding your pathology result, that's very important to understand about the receptors, because based on the type of receptors, you know your treatment, how it's going to be. And again, know your breast, a larger version. Macmillan, if you go online, Macmillan and Breast Care Now, there are lots of information there if you have any questions about breast cancer, or if you have any questions about prevention or anything like that. They are all in there, available for anyone. Yeah. Thank you very much. Thank you. Thank you. Thank you, Namoya. Thank you, Zarina. Thank you, Sharon, for all your help. I could have not done this without them. They put me up here, and they helped with the leaflets, so they ordered them. They are here. If anybody wants different leaflets, just let us know. We can order them for you. Thank you again.
Move there to make it easier. Okay, we want to thank everybody for coming. I'm going to ask the people that are present here to come through to the back hall, and we can give you the leaflets in the back hall, as we've got the lavender and rosemary, do it yourself, make your own diffuser. Okay, and for those online, we want to thank you for joining us. There are no more questions. I'll just do one more check. And we would like to invite you to join us tomorrow for how to build healthy habits. So that will be at 7 o'clock tomorrow, followed by Dr. Devron after that. So thank you for joining us, and goodbye to the live streamers. Thank you. All right, everybody else?